Wondering how to take care of your baby's cradle cap? Well, this is Dr. B of the Newborn Prep Academy, and that's what I am going to be talking about today. So over the next few weeks, I'll be talking about a few common questions that come up in the office when I take care of newborns. I'm a pediatrician, board certified, and I've been taking care of newborns for over 17 years now, more like over 18 years, and cared for thousands of newborns. And I have a few questions that come up all the time. So one of them is cradle cap. How do you take care of a baby's cradle cap? So a cradle cap is the sort of scaly rash that you find on the top of your baby's head that is sort of really sticky, very hard to remove, and sometimes can be mild, and other times it can be quite significant. Sometimes the hair also starts to fall off in the area, and they can typically have a rash also on the upper face or upper chest area with the cradle cap as well, because those scales tend to be irritating to your baby's skin. To start with, cradle cap really, if you leave it alone, will go away on its own. It might just take several months to clear, several weeks to several months to clear on its own, and it's not dangerous in and of itself. Not unless you start to pick at it and it gets infected or something along those lines. But the cradle cap in and of itself usually is not dangerous. However, it's not, fun to look at, and usually, like I said, sometimes can be irritating to your baby's skin. So to take care of it, you really just have to shampoo your baby's hair maybe a little bit more frequently, every other day, or at least 3 times a week. And if the scales are very adherent, one of the things you can do is apply some baby oil or even coconut oil to the scale, to the top of your baby's head, to the scales, to sort of walk it in and make it softer. I will just leave that on for 15-20 minutes before a bath, and then you shampoo the baby's hair using a shampoo that's for sensitive skin or non-fragrant shampoo. And you can either use your fingers to walk off the scales or use a baby comb or baby brush to sort of walk on the scales. There are some cradle cap brushes that you can find over the counter, in the stores, but you can probably just use your baby's regular comb for now to gently walk on removing those scales. It's not all going to come off in one go, especially if you have a lot of it, but each time you wash your baby's hair, a little bit more comes off. And as you start to decrease the amount of scales you have in the area, this rash tends to get better if your baby has a rash on their face and upper chest area. You certainly want to see a pediatrician or dermatologist if the rash is getting worse, if there's an odor to it, if your baby has a fever or anything out of the ordinary. Certainly, or the rash just is getting worse, you want to bring that to the attention of your pediatrician or a dermatologist. Well, so I hope that was useful. That's how you take care of a cradle cap. Feel free to send this or share this with a mom who has a newborn who may be dealing with the same issue. And again, this is Dr. B of the Newborn Prep Academy. Wherever you're watching this video, want you to like and subscribe to the channel. There are also resources that you can find here to help you on your journey to better understand your newborn and take care of them and enjoy the process. Again, this is Dr. B of the Newborn Prep Academy, and I'll be back again next week answering another question. Take care.